Okay, my presentation has three parts. First one is the definition, and the second one is the history, and third one is the influence mechanism. I wanted to keep it short. Electroconvulsive therapy, ECT, as you all know, for the purpose of treatment of a disease. This is the electricity stimulant given externally, and grand mal type epileptic seizure is being created, and this is a biological treatment method. Grand mal epilepsy seizure appearance in the brain is enough. We don't see peripheric tonico-clonic tensions. We don't see that in order to provide the efficiency of the treatment. And in the modified practices that we have today, the ECT practices, we don't see peripheric symptoms. If we want to see, we can try it with a band. And we follow EEG, we follow the patient with EEG and EMG. There are wrong names like the electrical treatment, electrotherapy, and among public it's called as shock, electroshock, shock treatment. These are wrong definitions because these terms are intimidating when you call it as shock. Electroconvulsive therapy. When we look at the history, Paracelsus, camphor was used to treat the delirium, insanity, but we don't have any information about that. Amberger in 1764, mania vivorum was treated with camphor by injecting it every 2 hours, and this is the first information about the recovery from the disease with the epileptic seizure. And Descartes with camphor injections, then it is creating epileptic convulsions, but the method did not become popular. The most interesting information, Stransky, a schizophrenic patient, because of electrocution, the schizophrenic symptoms were completely lost in a certain case, but this case also didn't become popular. And one of the milestones in this matter is Meduna, antagonism between the schizophrenia and epilepsy. If a person does have an epilepsy, that person can't have schizophrenia. And if this schizophrenic patient is cardiazol shock, then it can be treated. So if we can create epileptic seizure among schizophrenic patients, then we can cure it. Intramuscular camphor and intravenous letrozole, he started creating epileptic seizures. Of course, this was quite game changer in the history. It is not a trustworthy method, and the information backing this treatment is also false, because if there is schizophrenia, if there is epileptic seizures, there is no schizophrenia. But this is one of the important milestones. And another important name in that regard is the treatment of Sakel. Overdose insulin was taken by a patient, and she got in a hypoglycemic coma, and Sakel started treating people with the hypoglycemic coma, and with this insulin coma treatment till 1950, this was found to be the most effective treatment in schizophrenic patients. And the books we find most important during our assistantship was the Henri Michaud, even in the 1980s. If there is a diagnosis of schizophrenia, they used to say that a psychiatric cure can be given to the patient. They do have many side effects, many complications, and the risks are a lot. Therefore, how are we gonna evaluate this information? And the Italians started working on that. This is my speculation, by the way. Italians are quite agile people, and Strasky's patient, he was electrocuted and he got well. If we electrocute the patient, maybe he can be cured, but this is just a speculation, by the way. And with an electricity stimulus, they achieved creating an epileptic seizure, and afterwards ECT became quite popular for schizophrenia, and more than schizophrenia, in the depression, in the mania, it was found to be effective, and also for the treatment of some other psychiatric diseases. And it is one of the biological treatment methods. It was. Then it became quite common because we didn't have any medications back then, but after 1950s, the magic of ECT was ruined because of the giant steps taken in the psychopharmacology and the discovery of the drugs and their efficacy. They were proven to be better than the ECT. This was the first reason. And the second factor, the negative approach towards ECT. And this is because of the anti-psychiatric echo, but sometimes even the physicians, they thought that this is not a treatment method, this is a torture, and this was regarded equal with the electricity chair. And the cinema and the mass communication devices made ECT worse, made ECT's image worse. Many films. Therefore, ECT practices started to diminish. But after 1980s, ECT started to be used again. ECT is back on the table today. There are some factors creating the negative attitude towards ECT. The changes in the techniques and the anesthesia and the muscle relaxants are being used, and there are some patients who can't get better with any of the drugs, and it is affecting quite fast. And treatment-resistant patients can be treated, and the hospitalization period is less, and also treatment expenses decrease. And I do have many experiences, and sometimes patients ask for that. They say that I don't want to use drugs, have ECT on me. A deceased psychiatric professor in a congress stated that my recommendation to you, if I got into depression, please have ECT on me. If I become schizophrenic, don't show me as a case, and if I become Alzheimer, shoot me. Nothing happened. And the practice. You know how it is approached. Unilateral. This is the placement of the electrodes. I call it as the traditional method, the old method. There are two methods of practicing ECT. The simple practice, but the modified method is the most commonly used one. Anesthesia and the muscle relaxants are being used. And the frequency, at least 3, maximum 20. At the beginning of the treatment, maybe once or twice. 7 to 12 cures, there are many different opinions as to the frequency of the ECT practice. What does it do in the brain? The effect mechanism of the working mechanism of ECT is that it's an empiric method, by the way. We don't know about the working mechanism. Psychoanalysts stated that in order to cure the depression, it is unconscious reaction to the guilty feelings, and when ECT is being done, the patient is punished for those guilty, then he's forgiven and he gets better. That was the approach, but of course this idea was left, but this opinion gave us many headaches, because in Bakırköy Hospital, Europe was thinking that Soros Foundation thought about that, and we told them that it's not correct. We had the press conference. Kemal Sayar used to be my assistant back then, but unfortunately, in some internet pages, I was alleged to have such an opinion about the working mechanism. Let me tell you a couple of words. It's increasing the receptor sensitivity, both dopaminergic and also noradrenergic, and the stimulation of the hypothalamus, and also change in the synaptic content here, and noradrenaline and serotonin circle increases, and the encephalic centers send monoaminergic pathway activation towards hypothalamus and limbic region, and also the blood-brain barrier transparency increases, and the biological rhythms, circadian rhythm, is being regulated, and hemispheric dysfunction can be corrected, and right and left hemispheres synchronization is provided. And BDNF increase is created, and there are some against opinions as well. The function of stopping the convulsion is making the patient recovered. What is curing the patient is not the epilepsy seizure, but the brain's ability to end the seizure is curing the disease. It might be about resetting the brain or taking it to the factory adjustments. Thank you very much. Now I would like to give the floor to my young colleagues.